So you've been told you have a slipped disc or herniated disc either in your neck, the cervical spine, or in your lower back, the lumbar spine. It sounds serious and you're wondering what to do next. I'm Anthony Ghosh, a consultant spinal neurosurgeon and director of the Spine MDT. In this video, I'm going to explain what a slipped disc is, when it needs treatment, and what the options are for treatment. Let's run through the anatomy of the human spine. So here's the human spine on this diagram here. It's made up of a stack of bones called vertebrae that start deep in the pelvis and work their way up to the skull. Let's zoom in a little bit. So here in the lumbar spine, we have three vertebrae here that consist of a vertebral body, this cylindrical block of bone with an arch of bone at the back. If we stack these up, we create a tunnel in the middle known as the spinal canal, through which a bundle of nerve runs, and also the spinal cord higher up the spine, which is what transmits messages between the brain and the body. Each bone is then separated by these cushions that we call discs. Imagine a piece of crab meat, and this is how a lot of textbooks actually describe it, that's encased within a kind of fabric lining. These are little cushions that act as shock absorbers between the two bones and distribute the pressure evenly. And sometimes, often through wear and tear, the lining of that disc starts to wear thin, tear, and then a fragment of the disc tissue, that crab meat, can leak out and sometimes pinch either a nerve or the spinal cord itself. In the lumbar spine, if the disc herniation is big enough, it can pinch nerves, causing pain, sometimes weakness in the legs, and in severe circumstances, trouble with your bladder or bowel, such as urinary retention or even incontinence. If the slipped disc is higher up the spine, either in the thoracic spine or the cervical spine, the neck area, it can pinch or compress the spinal cord, and that can cause weakness of both the arms and the legs. If you only have pain in the back and no pain radiating down your legs or weakness or numbness, then it could just be a tear in the disc that's not pinching the nerve as shown here, causing some localized inflammation which eventually settles down. This certainly does not need any surgical treatment, and in fact the only real indication for surgical treatment is to preserve the function of any nerves or protect any of the nerves that go down to your legs or your bladder and affect the function of your legs and your bladder. So basically, if you have back pain and your scan has shown a herniated disc, we're actually speculating as to whether this is the cause of your back pain. And we know this because we have done studies in healthy adults without back pain who have had MRI scans that have actually shown herniated, dehydrated, sometimes torn discs, and these are completely incidental findings. So we are speculating to some degree. Nonetheless, the management of this is purely conservative, but ultimately the guidance is to actually try and move through the pain. You don't want to be lying still too much. You want to try and get up and try and walk through the pain, and eventually it should settle down. In the majority of patients, within anything from a few days to a few weeks, things do resolve and get better. If the disc is pinching a nerve and causing pain shooting down the leg, that's called sciatica. Now again, in the majority of people, this usually resolves within the first few weeks, and therefore this doesn't require any invasive treatment. The only indication to treat this surgically in the early stages, in the early weeks, is if you also have weakness going down the leg, or if there is pain going down both legs and dysfunction of the use of your bladder or your bowel, then that does become a clinical emergency. If it's just pain going down the leg without any weakness or bladder problems, there are certain maneuvers or manipulations that can be carried out by some osteopaths or physiotherapists that put the spine under a little bit of traction. So imagine here where we have the slipped disc, we were to kind of pull these two bones apart a little bit, create a bit of a vacuum in this disc space that can actually suck in that loose fragment away from the nerve. That's usually not tried or attempted by a lot of the practitioners I work with when the pain is very acute, because it's quite painful to carry out these maneuvers. So they usually wait a few days to a couple of weeks until that initial pain has subsided a little bit and then carry out that maneuver. If things are still not improving after a few weeks of pain, but you don't have any weakness, you've tried the physiotherapy maneuvers, an option is an injection into the spine where a needle is passed through the skin of the spine under x-ray guidance and directed towards the trapped nerve. A little bit of steroid is injected around the nerve to help suppress any inflammation, and there are studies that have shown that that is actually quite effective. The reason the injection works is it doesn't actually take away the disc herniation or the pressure of the spine, but the theory is in the majority of us the body will actually dissolve or break up that disc with time and take the pressure off the nerve. Some of the pain is due to the pressure, but a lot of people speculate that actually a lot of the pain is generated because of secondary inflammation caused by the pressure of that nerve. So if you take away the inflammation, most of the pain subsides, and then over time your body breaks down that fragment of disc and then it resolves the pressure on the nerve altogether. Then the final resort is surgery. So if the pain and the symptoms of leg pain specifically have gone on beyond 6 weeks, or you've developed weakness in the legs or problems with your bladder or bowel function, then we normally recommend an operation, and that's usually a micro discectomy. This is carried out under a general anaesthetic through quite a small wound in the back of the spine in the lower back. Under the microscope, we make a little window here in the arch at the back of the spine and then access this fragment of disc poking out, pinching the nerve and shave it away to free up the nerve. Whilst this procedure is under general anaesthetic, it's often either a day case or one night stay in hospital at the most. I usually advise a couple of weeks off work and then a phased return, depending on the circumstances, sometimes an early return to work. There are some risks with the operation which include damage to the nerves, but these are very, very rare and often the results are very good. To summarise, most herniated discs will actually heal on their own and don't actually need any treatment. If it's back pain alone, it's speculative as to whether that slipped disc is indeed the cause of the pain, and often it will settle down anyway. If you have leg pain, again, it should settle down within a few weeks. The only indications to do anything invasively are persistent pain beyond a few weeks, or weakness in the lower limbs, or trouble with your bladder or bowel. I really hope you found this video helpful. If so, please click that like button and do subscribe to the channel, and visit us at spinemdt.com to see ways we can help you. Thank you for watching.